Hey everyone, Dr. James Whitaker here from American Urologist, and today I have something absolutely crucial to share with you. Last week I had the privilege of sitting down with Dr. Charles Miller, a remarkable 88-year-old oncologist who has been practicing for over 50 years. What he shared with me about itchy spots in seniors completely changed my perspective on what we often dismiss as just getting old. Dr. Miller told me that perhaps when people hear of an 88-year-old oncologist still seeing patients, they might think, an experienced doctor with good knowledge. Many people probably think like that. But even now, every Tuesday and Thursday, the first thing he does is carefully examine each patient for signs that other doctors might miss. He doesn't rely on fancy equipment or expensive tests. He uses these hands and decades of experience. Even though he's been practicing oncology for over 50 years, he always starts by listening to what patients say about their symptoms. More than hearing people say, "My test came back normal," the most concerning thing is when a patient says they've been told to just accept discomfort as part of aging. What Dr. Miller shared with me is a vital truth that many don't realize. Your body's subtle signals are more important than obvious symptoms. What many don't know is that small, persistent changes like itching can be early warning signs, more important than waiting for lumps or severe pain. This is perhaps knowledge that even experienced doctors don't always share with patients. As an oncologist, Dr. Miller has learned to identify cancer warning signs that others might miss. It wasn't through expensive scans or complex procedures. The insight he shared with me is so simple it might seem unbelievable, but his 50-plus years of experience can prove it. He asked me, "What do you think most people do when they develop persistent itching?" They try lotions, change soaps, blame dry skin, or assume it's aging, right? These approaches certainly have their place, but in his experience, something is more important than topical treatments. Understanding when itching signals something serious happening inside your body. Recognizing these patterns is the key to catching cancer early. Dr. Miller confided that there was a time when even he dismissed certain symptoms as minor. Early in his career, he focused on obvious signs of cancer while overlooking subtle ones like persistent itching. He would treat patients with advanced cancer while missing the early warning signs that had been present for months. Even as an oncologist, he was trained to look for tumors and masses, not seemingly innocent symptoms. He was overlooking early signals. He would tell medical students to look for classic cancer presentations, while he himself was missing the subtle signs that appeared long before traditional symptoms. While he was treating patients with late-stage disease at the hospital, he was missing opportunities for early detection every day. Focusing only on textbook presentations, he overlooked the importance of listening to patients' descriptions of unusual sensations. As a cancer specialist, this troubled him deeply. Dr. Miller asked me, "Don't you think many doctors have similar blind spots? Everyday symptoms they dismiss without considering underlying causes? Maybe we're all experts who focus on what we expect to see rather than what patients are actually experiencing." Dr. Miller told me that his perspective changed completely when a patient made an observation that opened his eyes. A 75-year-old man quietly said to him, "Doctor, this itch on my leg feels different from anything I've experienced before, but everyone tells me it's just dry skin." Those words made him realize he had been dismissing potentially crucial symptoms. That day, after his last patient, Dr. Miller went through his files and looked for patterns he might have missed. He examined cases of patients who had developed cancer and looked back at their initial complaints. Then he realized what he had been overlooking: not dramatic symptoms or obvious lumps, but persistent, unusual sensations that patients had mentioned months before their cancer diagnosis. From that day on, he stopped dismissing minor complaints and started taking every persistent symptom seriously, especially in patients over 60. He began documenting patterns and locations of itching that preceded cancer diagnoses. Now he also teaches other doctors to listen more carefully to patients' descriptions of unusual sensations. Of course, not every itch is cancer, but certain patterns deserve immediate attention. At first, he noticed small correlations. He found that patients with certain types of cancer had mentioned specific itching patterns months before diagnosis. These weren't random itches that moved around the body. They were persistent, localized, and didn't respond to typical treatments. Most importantly, they occurred in 6 specific areas that he began to recognize as red flags. After documenting these patterns for several years, Dr. Miller had identified clear connections between location-specific itching and internal cancers. The itching would worsen at night, wouldn't respond to moisturizers, and often came with subtle accompanying symptoms. Most importantly, when he started taking these complaints seriously and ordering appropriate tests, he was catching cancers months earlier than he had before. Remarkably, this approach didn't just help with cancer detection, it changed his entire practice philosophy. Once he started listening more carefully to subtle symptoms, he became better at detecting all kinds of health issues in their early stages. His diagnostic accuracy improved, his patients felt more heard, and his treatment outcomes got significantly better. Taking seemingly minor symptoms seriously truly transformed his medical practice. Dr. Miller explained that once you understand the complete picture, everything makes sense. He shared with me 6 specific body locations where persistent itching can signal serious internal problems. These aren't at random observations. They're patterns he's documented over decades of careful attention to patient symptoms. Before I share these with you, make sure to subscribe to American Urologist for more crucial health insights from experienced physicians. How about learning something that could save your life today? Subscribe now and set up notifications to get life-saving medical information first. 6 critical itchy spots that demand medical attention. Location 1. Lower legs, especially the front. Dr. Miller emphasized that persistent itching on the front of the lower legs, particularly when it doesn't respond to moisturizers, can be an early sign of lymphoma. When the lymphatic system becomes inflamed, it releases substances that stimulate peripheral nerves, causing a very specific type of itching that's different from skin-related itches. Why is lower leg itching particularly concerning? When lymph nodes are affected by cancer, the inflammatory response creates nerve stimulation that manifests as itching in predictable patterns. This isn't surface-level skin irritation. It's deep, persistent, and typically worsens at night when lymphatic activity increases. Many people treat this with lotions and assume it's circulation problems, which creates dangerous delays in diagnosis. The itching is often described as internal, something you can't satisfy by scratching. It frequently occurs at specific times, particularly around 3 a.m. when lymphatic circulation peaks. He told me about a patient, a 75-year-old man named Johnson, who had been experiencing front lower leg itching for 3 months. Despite trying every moisturizer and circulation treatment, the itching worsened and became so severe at 3 a.m. each morning that he couldn't sleep. When they finally tested him for lymphoma, they caught it in early stages when treatment success rates exceed 90%. Dr. Miller shared the key differences to watch for. Apply moisturizing treatments consistently for 1 week. If the itching doesn't improve or actually worsens, suspect internal causes. Pay attention to timing. Lymphoma-related itching typically peaks at night when you're lying down. Most importantly, this type of itching cannot be relieved by scratching and often feels like it's coming from inside the leg rather than the skin surface. The most important thing is not to dismiss persistent lower leg itching as circulation problems or aging. If moisturizers don't help within a week and the pattern fits what I've described, see a hematologist immediately. Early-stage lymphoma has excellent treatment outcomes, but delayed diagnosis significantly reduces survival rates. He asked me, have you experienced any unusual itching sensations in your lower legs that don't respond to typical skin treatments? Location 2. Middle of the back. Specific spot. Dr. Miller explained that persistent itching in a specific spot in the middle of your back can be an early warning sign of pancreatic cancer. The pancreas connects to back nerves, and when pancreatic problems develop, they often signal through referred nerve pathways that manifest as persistent back itching. The connection isn't obvious, which is why this symptom is so often missed. Pancreatic inflammation or early malignancy causes bile flow disruption and nerve irritation that gets referred to the back through shared nerve pathways. This creates persistent itching in a very specific location that patients can point to with one finger. Many people assume it's mattress problems, clothing irritation, or muscle issues, leading them to try everything except medical evaluation. The itching typically worsens after meals, particularly after fatty foods, because that's when pancreatic function is most demanded. He shared the story of a 68-year-old woman named Williams who had tried everything from new mattresses to allergy testing for persistent middle back itching. She had replaced bedding, done house cleaning, and seen dermatologists, but nothing helped. The pattern that finally made Dr. Miller suspicious was that her itching consistently worsened after dinner, regardless of what she ate. Dr. Miller detailed the self-assessment technique. Press gently on the itchy spot with your finger. If it's pancreas-related, you'll feel deeper discomfort or heaviness beneath the surface. Pay attention to digestive symptoms that accompany the itching, particularly difficulty digesting fatty foods. The timing pattern is crucial. Pancreatic-related itching often worsens 2 to 3 hours after eating. Don't dismiss persistent back itching as muscle problems or assume it's related to sleeping position. If the itching is in one specific spot, worsens after meals, and doesn't respond to topical treatments, pancreatic evaluation is essential. Early pancreatic cancer detection dramatically improves treatment outcomes. Location 3. Scalp, particularly behind ears and neck. A concerning area that Dr. Miller emphasized is persistent scalp itching, especially behind the ears and at the neck hairline. This can be an early indicator of leukemia, where overproduction of white blood cells creates inflammatory substances that stimulate the tiny nerves in scalp tissue. The scalp symptom is particularly tricky because people immediately assume it's shampoo, dandruff, or hair product reactions. However, leukemia-related scalp itching has very specific characteristics that distinguish it from typical scalp issues. There's usually no visible dandruff, redness, or scaling, just persistent itching that's worse in certain areas. Many people go through elaborate elimination processes, changing shampoos, trying natural products, and even consulting dermatologists, while the real cause remains unaddressed. The itching is typically worse when lying down because blood circulation patterns change, causing inflammatory substances to accumulate in scalp tissues. He told me about a patient, a 73-year-old man named Harris, who kept detailed records of his scalp itching for 3 months. Despite changing every hair care product and routine, the itching persisted. What made Dr. Miller suspicious was that Harris reported the itching was worse behind his ears and only occurred when lying down. During the day, he felt fine. Dr. Miller shared the diagnostic approach. Feel your scalp gently. Leukemia-related itching often creates slightly warmer spots due to localized inflammation. The pattern is crucial, worse at night when lying down, concentrated behind ears and neck area, and completely unresponsive to shampoo changes or scalp treatments. The most important thing is to recognize when scalp itching isn't responding to logical treatments. If you've tried different shampoos, eliminated potential irritants, and the itching persists, especially if it's worse at night, blood work, including complete blood count, is essential for ruling out hematologic malignancies. Location 4. Chest area, particularly around breast tissue. Dr. Miller stressed that persistent itching around the chest, particularly near breast tissue, can indicate inflammatory breast cancer in women, or the rare but serious male breast cancer. When lymph nodes become blocked by cancer cells, the tissue develops a characteristic orange peel appearance, often preceded by persistent itching. This type of cancer is particularly dangerous because it doesn't always present with obvious lumps, making itching one of the earliest detectable symptoms. The cancer causes lymphatic blockage that creates both the textural skin changes and the nerve irritation that manifests as itching. Many women assume it's bra-related irritation, fabric sensitivity, or skin reactions, leading them to try different clothing materials and skincare products while missing the underlying problem. Men often dismiss chest itching entirely, not realizing that male breast cancer, while rare, does occur and typically affects men over 60. He shared about a patient, a 69-year-old woman named Davis, who experienced persistent right breast itching that she attributed to bra problems. She tried cotton, silk, and bamboo fabric bras, even went braless with loose clothing, but only the right breast remained itchy while the left was completely normal. Dr. Miller explained the examination technique. Look at both breasts in a mirror. Inflammatory breast cancer often creates subtle texture differences, slight swelling, or color changes before obvious lumps develop. The itching usually starts around the nipple area or under the breast and is typically one-sided rather than bilateral. The critical point is not to assume breast or chest itching is clothing-related, especially if it's persistent and one-sided. Both women and men over 60 should take chest area itching seriously, particularly when topical treatments don't provide relief and there are any accompanying skin texture changes. Location 5. Anal and reproductive organ areas. A sensitive but crucial area Dr. Miller discussed is persistent itching around the anus or reproductive organs, which can indicate anal cancer or vulvar cancer. The developing tumor compresses surrounding tissue, stimulating nerves and creating persistent itching and stinging sensations that are distinctly different from hemorrhoids or typical infections. This area is particularly problematic because people are embarrassed to discuss symptoms and often self-treat with over-the-counter products, assuming they know what the problem is. Additionally, people with existing conditions like hemorrhoids may dismiss new or different symptoms as flare-ups of familiar problems. Many patients delay seeking medical attention due to embarrassment, or they assume symptoms are related to hygiene, diet, or pre-existing conditions like hemorrhoids. The delay can be dangerous because cancers in this area can progress quickly when not caught early. He told me about a patient, a 76-year-old man named Ryan, who had dealt with hemorrhoids for 30 years. When new itching symptoms developed, he assumed it was another hemorrhoid flare-up and tried all his usual treatments. However, this time the sensation was different. Instead of pain with sitting or bowel movements, he experienced persistent itching even when completely still. Dr. Miller outlined the key differences. Cancerous itching in these areas is typically concentrated in one specific spot rather than the general discomfort of inflammation. The sensation is often described as needles rather than general irritation. Most importantly, it worsens over time rather than improving, and standard treatments for hemorrhoids or infections provide no relief. The essential message is never to delay examination due to embarrassment, and don't assume new symptoms are just flare-ups of existing conditions. If itching in these areas doesn't respond to appropriate treatments within a reasonable time, or if the sensation feels different from previous experiences, medical evaluation is crucial for early detection. Location. 6. Palms of hands and soles of feet. The final location Dr. Miller emphasized is persistent itching isolated to the palms of hands and soles of feet, which can indicate internal cancers that are producing toxins affecting peripheral nerves through the bloodstream. This symptom typically appears when cancer has reached a certain stage, making recognition particularly urgent. This symptom is often misdiagnosed as contact dermatitis, housework-related irritation, or circulation problems, leading people to try topical treatments that cannot address the underlying systemic cause. The itching specifically affects the palms and soles because these areas have the highest concentration of peripheral nerve endings. Many people assume it's related to cleaning products, frequent hand washing, or diabetes-related circulation issues, especially since it commonly affects older adults who may have multiple health conditions. The specific pattern, affecting only palms and soles while sparing other areas, is the key distinguishing feature. He shared about a patient, a 70-year-old man named Alan, who experienced persistent palm itching that he attributed to dishwashing and household chores. Despite wearing gloves, changing to mild soaps, and applying moisturizers multiple times daily, only his palms itched while the backs of his hands remained completely normal. Dr. Miller described the diagnostic features. Look for yellowish discoloration of the palms and soles with deepening of the natural lines and creases. The itching pattern typically affects both hands and feet simultaneously and worsens at night. Standard moisturizing treatments may provide temporary cooling, but don't address the underlying cause. The crucial point is that palm and sole itching in older adults should never be dismissed as skin problems or circulation issues without proper medical evaluation. If moisturizing and topical treatments don't resolve the symptoms within a reasonable time, comprehensive cancer screening is warranted. And then Dr. Miller concluded by saying that the secret is in paying attention to your body's signals. The care we put into recognizing these warnings is what matters. Early detection can save lives, but only if we're listening. Now is the time to start taking these symptoms seriously. Your body is constantly communicating with you. From today on, let's give more attention and respect to what it's trying to tell us. What an incredible conversation this was with Dr. Miller. His wisdom from over 50 years of oncology practice has opened my eyes to how we can catch cancer in its earliest, most treatable stages by paying attention to symptoms that are often dismissed. I'll be joining you in the next video to discuss more early warning signs that experienced doctors have learned to recognize. Until then, examine your body tonight and take note of any persistent itching in the areas we've discussed. Thank you for watching American Urologist, and remember, your body's signals could save your life.